How to use the EHS registry. You go to the website and you click on the link to enter the database. You will enter with your username and password and you log in. Then you click on Start a new case. The system will give you a 4-letter word which will be the patient ID. It's your responsibility to keep the link between the patient and the ID. It's also your responsibility to get informed consent. If you do not click on informed consent, you will not be able to introduce a case. The dataset is completely anonymous, so there's no date of birth, there's not even year of birth. You also will not register the height and the length, but the BMI will be calculated or introduced by you. You will be able to introduce a study number if your patient is included in some kind of a prospective study. Also, comorbidities are limited in number and also in follow-up questions are very limited. You will be able to introduce quality of life score, which is in this case the EHS quality of life score, where you will be able to answer the data that the patient has given. The operative data, you obviously will be able to enter the date of operation and will have to choose groin, primary ventral, incisional or peristomal. You will introduce the width and the length and you will be able to click on the image or click next to the name of the area where the hernia is. Type of access: open, endoscopic or robotic assisted surgery. When you enter one of the choices on robotics, you will be able to give in data on the system that you use and also on the instruments that you are using. Surgical technique, non-mesh or mesh. If you put in mesh, you will be able to register the mesh position by either clicking on the image or on the name, and you will enter the meshes of certain company, also with the name of the mesh. The lot number of the implanted mesh will be introduced, the width and the length, and also whether you fix the mesh, whether that will be with absorbable sutures or tackers or non-absorbable. Intraoperative complications, of course, you either do none or when you have a complication you will be asked follow-up questions. You have to keep the identity of the patient. At the end, when you save it for the first time, you will be asked if the patient is part of a group that you've created or you're attributing to. Thank you.